Hi, this is Adam Baser with IHE USA. Kristine Mullen is the North American market leader, population health management at Philips. Throughout her career, Kristine has been a passionate advocate of innovative digital health offerings that provide healthcare practitioners, employers, and members differentiated solutions focused on improving health and well-being, slowing the progression of disease, and increasing productivity. Kristine, thank you so much for joining us today.
Thanks. I'm happy to be here, Adam. Thanks for having us.
Well, we're happy to have this discussion. So let's start with what's been top of focus really around the globe over the past year, and that's COVID-19. It's obviously had wide-ranging impacts from a population health perspective. From your provider organization clients, what type of advice, guidance, support have they reached out to you for as they've been responding to COVID-19?
Yeah, that's a really great question. We've really seen the gamut, everything from virtualizing care, the importance of interoperability, the importance of understanding how to interact with patients, get in front of, business intelligence, having a more robust predictive models, really realizing that care is virtualizing, right? And so as care is moving outside of the four walls of the hospital, or, as providers are having to manage patients more remotely, how do they do that? How do they have the clinical confidence? How do they extend care outside of facilities or offices to really provide and accelerate the quadruple aim, right? At the end of the day, it's about improving outcomes, reducing costs, and improving both patient satisfaction and clinical satisfaction. But with COVID, there's this extra layer of risk, right? Safety for the patient and safety for the clinical team. And so how do we do that and leverage technologies, the exchange of data, creating interoperability that allows that clinical confidence and expertise to bear fruit and pull forward so that they can realize that quadruple aim.
So coming out of the, I'm sorry.
Yeah.
Go ahead.
No. So in that context, it's really around technologies, capabilities, and solutions that are really aimed to kind of reduce those burdens, right? In terms of, helping us with teleservices. So how do we enable televisits? How do we enable technologies to make it easier to have both synchronous and asynchronous interactions? How do you connect data that is interoperable, where you federate and liberate the data and you aggregate it in ways that are meaningful? And then how do you help them with the clinical kind of tools, if you will, in terms of turning the invisible signals that happen between clinical encounters into visible signals that you can get in front of health events, right? Whether it's understanding the data, navigating it into a common repository that you can then build some artificial intelligent models around, and then really navigating the patient and activating them into the right and appropriate intervention. So
you talked a little bit about what you've been seeing and what your clients have been seeking as they've been responding to COVID-19 and you've been working to support them. What gaps have emerged from your perspective in terms of whether it's a technology standpoint, a process piece, even a personnel piece? Where are those gaps, and what lessons do we want to learn from this experience to better impact our ability to respond in the future?
Yeah, it's a great question. When we think about pre-COVID environments, the real kind of challenge was really around adoption, right? Around things like population health management, adoption of remote patient monitoring, adoption of virtual care for a couple of reasons. One, the reimbursement wasn't clear. Two, there was this sort of point of view, particularly in the clinical side, right, on the provider side, that hey, having hands on a patient is actually better in terms of clinical outcomes and quality. So we saw those things pre-COVID. I think COVID accelerated this major shift towards virtualized care and really demystified, right? Because overnight you had like this huge sweep of adoption, right? And the tipping point was achieved and exceeded. And so from that perspective, as we think about where the new challenges are now, given the fact that this adoption has occurred, it's really around movement towards reducing the burden on the patient themselves. So when you think about, historical kind of approaches, whether it's to remote population health management, treating those living with chronic conditions, we leverage a lot of technologies that, are certainly appropriate clinically. So think a weight scale, or think a blood pressure cuff, or think an SpO2. And those things are helpful, particularly with patients with diabetes or congestive heart failure, et cetera. But you're also seeing this proliferation of new devices where you can capture continuous passive measurements of patients that really allows you to understand this convergence of clinical analytics overlaid with consumer analytics. Because it's not enough to just simply know that, hey, this patient with congestive heart failure is likely to have this event based on a change in weight. It's also important to understand what's the likelihood of this individual patient. Are they more likely to comply with the recommendations that you give them? Do they need a nudge in terms of sort of activation and engagement, that sort of thing? And so as we're sort of seeing some of these new kind of changes, it's about the power of analytics coming together in a unique way that really helps not only the clinical practitioner understand and get in front of health events, reducing the flags fatigue that we talk about in this industry, right? Where, I could have a false positive based on a metric, but how do I leverage a standard deviation change, which I couldn't do based on minute level data, as opposed to a once measurement every day or a twice measurement every day to be more uniformed around capturing a proliferation of device information, whether it's physiologic, biometric, and vital signs, in a way that helps me complete the picture around the patient, and really also understand these smaller signals around your adherence, likelihood to adhere, your likelihood to engage, kind of indices in order to kind of move the clinical quality and improvements overall.
So as you mentioned the role of data analytics in all of this, and as we're thinking about COVID and the way it's impacted different areas differently, what role do you see the ability or even the inability to effectively track demographic data? What role do you think that has in from a health equity standpoint when we think about changes that we want to make, ways to be able to support the collection of that kind of data more broadly?
Yeah, so I think it's about democratizing access to data for all. So as you think about health equities, as we think about the role of social determinants of health, these are all important attributes and aspects as we think about the overall health picture of a patient population. And when we talk broadly about populations, it's about trying to really level the playing field, if you will. So, if I happen to live in a rural geography, I may have inequities in terms of my ability to engage with a telehealth service because I don't have access to Wi-Fi. So how do we make it and enable that care can be rendered remotely and equally across all individuals? We're also seeing great disparities in terms of, COVID, in terms of, older populations more infected than younger. Certain demographics are more impacted than others. And so, one of the great things that are happening as we think about, telehealth, virtual care, that we're hearing come from the provider community is that actually a window into the patient's world, understanding how they live, the environments in which they live, do they have to walk upstairs, don't they? Do they have gait compromised or not? How is their ability around activities of daily living? These are some of the inherent benefits that the clinical team is seeing in terms of being able to leverage virtual care. But the role of analytics is really around how do you capture and engage and really create environments that you can manage people across sort of where and how they live, across the acuity settings of their care attainment, and also about the acuity by which, their condition sort of represents, right? And to the extent that we can leverage more insights around the clinical as well as consumer attributes to care, then we can actually reduce some of those barriers and inequities that oftentimes happen. As I mentioned, we're hearing providers really find great value in understanding a bit more about that environment. And the reason for that is I can understand their social support context. I can understand the technology context, their adoption, right, their ease and use of equipment, et cetera. I can also understand kind of the barriers that they're living in, right, with respect to their condition. And so, you know, when and how we can use data as well as sort of technology to really help create more of a consistent sort of approach, but also eliminate and demystify some of the inequities that inherently exist, then care will be improved for all citizens and for everyone across the United States. And that's really where, you know, when we think about rural health initiatives, or we think about some of the things we've done in collaboration with the, you know, Veterans Administration, right, of putting virtual care pods in local rural communities where people can come to a common place and access telehealth or access remote monitoring, so that if they live in an area where they don't have Wi-Fi connectivity, you can enable that, right, in new and evolving ways. And so I think this landscape, this world of COVID has taught us a lot and shown a light on the importance of leveraging technology, but creating technology even in the absence of where you might have gaps, you know, leveraging a connected hub that allows Bluetooth enabled over a telephone line, right, to really create a rich environment for somebody who doesn't live in an environment where, you know, 5G signal is really strong, right? And these are the types of things that as an industry we need to solve together and really work towards really enabling folks to have the care they need anytime, anywhere. And that's really, I think, the power of what COVID has created and accelerated, and the mission that companies like Philips and others are really tackling.
You're kind of leading into my next question, and you've talked a little bit about you know, some infrastructure needs as it relates to remote patient monitoring. What else is out there? What do we need to do now in the near term to you know, build out the type of remote patient monitoring infrastructure that we need to be able to respond to this crisis and the next one that will come along?
Yeah, I mean, some of the major barriers, right, have somewhat been dealt with, right, here in the United States at least, where we're lucky where there's been an adoption at the federal level for Medicare, at least, right, where things like remote patient monitoring now are reimbursable, right? That doesn't necessarily mean that applies to Medicaid or Medicare. And so we have some more work to do as a country and as a people and at the state level to really create parity for telehealth, create parity for remote monitoring, and really sort of enabling that. We're seeing advances in technology, you know, as it relates to that, but we need more infrastructure as it relates to things like, you know, the simple creation of a data lake where you can create an ecosystem that's connected, where data from, you know, a series of agnostic devices can come together in an interoperable way that really will allow you to get to the clinical insights, right, as well as these consumer insights that I was alluding to earlier. And today, you know, many companies still are not fully, they have a lot of tech debt, right, where you haven't maybe pulled off the Band-Aid to really go full cloud. You haven't implemented necessarily APIs that are truly interoperable and connect and communicate to one another, where the data can be federated and transferred and passed across, you know, disparate systems and disconnected systems. You know, lots of companies tend to sort of create an interoperable path between their own solutions and technologies, not coexisting with others. So it's really around creating a world where you're creating a connected ecosystem where your capabilities can coexist and stand side by side with the other technologies that other companies are using or patients are using to really create a way in which the data and analytics can live and coexist together that you can then take and create action against, right? Drive the insights and analytics and really allow and empower the clinical team then to really leverage their muscle and their expertise around managing care for the better, right? And really trying to help drive better quality and improved outcomes. And to the extent that as an industry we can do that, and we can allow for sort of these foundational sort of gaps or stop breaks that happen naturally to sort of be eliminated, and kind of create some muscle around kind of the deep analytics, moving from descriptive to predictive to orchestration type of analytics with the underpinnings around artificial intelligence and machine learning, the better off we will be as an organization. It's about efficiencies, quality improvements, and outcome drivers.
So to finish our conversation, looking at the North American market and particularly in the U.S., you mentioned organizations grappling with how they want to effectively utilize APIs. Obviously, everyone is responding to the data sharing needs that are layered into the 21st Century Cures Act. We're talking about a really different type of interoperability in terms of thinking about it with a much more of a patient focus at the center. When thinking about the type of advice that your clients, other organizations like yourself and their clients, the type of advice that those provider organizations are going to be seeking, how would you guide those organizations to respond to this next phase of interoperability, this much more patient-centered, patient-focused phase?
Yeah, I mean, there's lots of ways in which industry has sort of talked about or coined sort of ways in which you could address this, right? We've heard phrases like a digital front door, right? So how do I create an experience that connects everyone and has them come through kind of this common repository, common access point? How do I create both synchronous and asynchronous interactions to really kind of keep people connected into kind of the virtualized care environment? How do I think about, the different data exhaust that comes off of both consumer-grade devices versus medical-grade devices? And the reality is there's not a single bullet, right, or a single sort of one of these levers that is going to drive nirvana. I think it's really around having a holistic strategy that allows you to really understand, what is it from the consumer's point of view that's going to create value? What is it that the consumer is engaging with already? What's the time value creation and burden on that patient? And if we want to create sustained engagement, if we want to create sort of activation of that patient, so that we can all achieve kind of, great impact both on their health and ultimately allowing them to live their best life, then it's really around that burden conundrum has to be reduced, right? So how do we do this in a way that it can become a bit more passive, that the consumer experience is at the forefront of the experience, and at the end of the day, we realize and recognize that patients are people first, and that patients really don't define themselves by their conditions. Oftentimes in our world, we talk about language in the construct of, patients, right, as opposed to consumers. We talk about and use language around individuals with who are diabetic as opposed to individuals with diabetes. And I think that it's simple, but it's also a mind shift that until we can really see the consumer at the center of the experience, then the solutions and technologies, the interoperability, all these things that we wrap around them will be missing that sort of human element, right? And so at the end of the day, it's about, in parallel, understanding that language and approach matters and understanding what are the pain points and clear value proposition to the end consumer. And then how do we bring solutions, technologies, software, data to bear in meaningful ways that will not only create an active, engaged patient, but sustain that consumer engagement across kind of the life cycle, right? And so whether it's a digital front door that's your gateway in, or it's thinking about things like remote patient monitoring, to the extent that we can really truly decrease that burden, but provide value in meaningful ways that the consumer is going to value and appreciate, then we can achieve sort of that quadruple aim much more quickly, right? We can realize and sustain that patient such that we can create greater value across the board. And so I do think that in the end, you know, a lot of what we have to do is design software and technology co-created by and with consumers, by and with customers, by and with, you know, individuals. And, you know, some companies do this really well and others are on their learning journey. But I think, you know, to really exercise against that, that's what we need. I love the fact that, you know, organizations, whether it's a Cleveland Clinic or others, where they have created a consumer experience officer, right? And that just kind of shows the commitment here that at the end of the day, we're treating individuals who don't define themselves by their health, but rather define themselves by, you know, being able to walk their daughter down the aisle or being able to do something with their grandchildren. And if we recognize that and bring the technologies and software and solutions to bear that will enable that, make it easier and allow them to achieve their best life, then we can have a lot more success.
Kristine Mullen is North American market leader. I'm sorry, let me start that over. Kristine Mullen is North American Market Leader, Population Health Management at Philips. Kristine, thank you so much for joining us today.
Yeah, thank you. My pleasure.